Wonderful. Good afternoon. My name is Alex Stinson. I am your presenter today. The way our webinars work, generally speaking, is I will be giving the presentation. However, my partner, Jennifer McGillis, will be alongside monitoring the questions and comments. So she will be responding to anything, and if there's anything that I need to address in the actual presentation, she'll alert me to that so that we can make sure that you're getting all the information that you need. So this month's webinar is Building an Ergonomic Committee's Success. I've been fortunate in my career. I've actually been a part of numerous ergonomic committees and definitely can speak to some of the things that I've seen done really well as some of the things that maybe we can improve on. So that's kind of going to be the flow of today's webinar, just talking about where you want to spend your energy, maybe where you want to pull back a little bit. So one of the things we do want to talk about is why you would want to partner with Pro Ergonomics. We have seen huge savings for the clients that we work with in bringing down their injuries and their costs due to claims, as well as our goal is to improve productivity and efficiencies within the workplace, because we're just making the workstations and the work environment that much more ergonomic, so that it should have a positive impact on your productivity. We are all certified ergonomists, which is rare in our industry, so we're proud of that fact. And although you may be working with one account manager or one consultant when you do an assessment or work with us, you will always have all of us kind of on board. We have a very team approach. We all conference about solutions to your problems, and we customize those to meet your needs. And we have worked in every industry, which is something, again, we are also very proud of. So we can help. Please give us a call if there's ever anything you want to do or partner. Some of the consulting services that you could expect from us are ergonomic risk assessments, physical or cognitive demands assessments, office ergonomics, return to work. We will help you with maybe job coaching or compatibility if there's a claim that you're not sure was caused by the task that the individual was doing. We have excellent trainers, and we'll customize our training so it can be either done in-house or to a more generic group, as well as we by default kind of run with the health and safety service as well, doing work well audits and safety program kind of planning for you to help improve just your holistic program on the whole. So today's agenda, we're going to talk first about why an ergonomics committee. We all know you have health and safety committees. Why do I need to add yet another committee to my corporate strategy? So we'll talk about that. We'll talk about how are you going to select that team, and who maybe the key players are going to be, and how we want to strategize, some of our meetings. Ergonomic assessments and tools and how we're going to be able to use those. Definitely talking about training, and most importantly, kind of the controls and how effective your committee is actually being. And lastly, again, as I mentioned, I've had just great opportunities and have worked with some great committees, and hopefully can express some of their success stories and what they've done. And I have a couple of unique examples to kind of share. So the first one is why an ergonomics committee, and looking at these pictures, I think, they definitely elicit a very visceral response. Fire, electricity, biohazard, those are scary subjects. And if you have any of those in your workplace, it is really hard to get the focus off some of these very life-threatening, endangering hazards. And when we look at, ergonomics and the severity, it is really hard for us when we're working on a committee and when we're identifying hazards and assuming that they're all weighted equally. I'm not sure we can say that when on a severity spectrum, that ergonomics is going to kill someone. In fact, I can conclusively say it won't kill anybody. So, however, some of the hazards that we're looking at right here most definitely could. So when we look at ergonomics on top of or in conjunction with our health and safety, it really becomes challenging to elevate them up the ladder to be looked at as important and motivating to kind of implement some controls to help minimize those ergonomic hazards, because they're always going to be, a C rating type thing, because that severity rating is going to be so low. Your frequency may be high, but your severity is going to be low. So we often find that when we're looking at our ergonomics, people have varying kind of backgrounds on where they come from. And those are the impressions that people are coming to our committees. So whether it be your health and safety committee, whether it be an ergonomics committee that you're currently working with, their perception of what ergonomics is often changes. It may be very scientific in that, it's being related to the hazards and we're looking at force and posture and repetition. It may be because they themselves have had, chronic pain or discomfort, or they know someone who has, and that's really where they're kind of putting their stake in. Or they're looking at it from an operations or process type of point of view. And really, we can't ignore any one of those aspects, but it really does change how a committee can work depending on what their background and what their influence is when it comes to ergonomics. So we're wanting to make sure that what is ergonomics is going to be clear for our committees, whether it is you're using your health and safety committee to push through your ergonomics program and some of your initiatives, or whether you have a steering committee specific to that. That's a clear communication that needs to be established first, because it definitely changes the flavor of your meetings and the tone, and depending on what your objectives are, can skew your results a little bit. Right now, what we seem to find most often is when we're looking at, do we develop an ergonomic committee, it really falls down on what is our ergonomic motivation. And has been, always probably will be, our musculoskeletal disorders, our injuries are always going to be a really key steering point and motivation point for us. And when we look at the statistics that we have, we've kind of been balancing between 42 to 50% of all workplace injuries are musculoskeletal in nature. And when we're looking at what does that mean on our lost time days, that's going up to about 50%. And it doesn't matter if you're Schedule 1 or Schedule 2. So this is the latest WSIB kind of summary report. And as you can see, we're kind of hovering between the 40 and 47 mark. Overexertion kind of being a key point, and low back being our body part. So very similar whether you're Schedule 1 or Schedule 2 company. Either way, really shows that as far as your injury rates go, MSDs are your highest frequency. Again, it's just a matter of how do I elevate them on the severity rating so that they're being addressed in a health and safety committee. There is a certain amount of understanding that needs to go along with ergonomics, and that is challenging to get across when we are looking at doing ergonomics through our health and safety committee, because combining the two kind of dilutes our information pool. Whereas if ergonomics is just our focus, we can then really streamline how we're addressing it and how we're moving forward. So selecting your team can be a very, very key point. It's not necessarily that we're having to create, professionals and certify everyone on the team in ergonomics, but we definitely want them to have a certain mindset when it comes to that. And there's certain people that will naturally do that better, shall I say. So when we're looking at the who, we want to structure our committee similar to a joint health and safety committee. It should be an extension of, so you may choose to have members of your Ergo committee be a member or representative from your joint health and safety committee. They can then act as a voice and report back to the joint health and safety committee, since that is the committee that would be under any of your due diligence. Ministry of Labor has interest in your joint health and safety committee, so it's a nice way of tying those two together. So a member from your joint health and safety committee would be a great addition. You definitely want to have your worker representatives and your management. Other key components, though, are your engineering, your maintenance, your continuous improvement. Anyone from those departments that you could pull from are going to be such value-added participants, because you're going to be able to mitigate and shortlist your controls just by having a discussion at the table. So where I've seen a lot of my committees struggle is the sheer volume of options that are out there when it comes to putting in an MSD control. So when we're looking at, a health and safety control and we have a hazardous chemical, our solution and our controls are fairly streamlined. We want to get our MSDS sheets. We want to get maybe, is there a less harmful chemical that we could use? No? Okay, well then we want to put PP in place. And it walks us down a really very systematic kind of approach on dealing with the control. Unfortunately, ergonomics is kind of considered to be a gray science, which is wonderful and challenging all at the same time. It means, really options are limitless, but at the same time, options are limitless. So we'll often see committees have laundry lists of hazards and corresponding to those laundry lists of controls. And it becomes challenging to kind of wade through those, figuring out which ones we need to do, which ones are feasible, what's possible, what's going to make a positive impact. Engineering, maintenance, continuous improvement are going to have very poignant pieces of information, and they're going to be able to tell you that's possible right away or it's not. So you can really start to filter some of the noise out of your to-do list by structuring your committee to have people that really do ergonomics maybe inadvertently in their day every day. What I usually recommend is to see if you can always kind of keep engaged with what the issue is by looking at expanding or narrowing your committee group. So when I'm talking about expanding, I'm talking about maybe we are looking at bringing in a new lift assist. Maybe we want to bring that vendor in and talk to our committee so that committee can then have just a much better understanding of how that lift assist is going to work and how that vendor is going to bring that in. If you don't have engineers on your committee, maybe that's a time constraint. Invite them in if you're doing a more engineering control or having a subject matter where the control is going to be just a little bit higher level and going to be requiring some design or changes in that field. So that's someone you could bring in. A subject matter expert. Your operators may change. You may have a static worker member that's on the committee, but if you're looking at, let's say, the forklift drivers in your operation or the nurses, you may want to have a couple of key people come in so that they feel engaged in the process. Also, they're going to give you great information on what the actual problem is. You may have perceived it differently. So your subject matter experts become key. Purchasing is another one, specifically if you are going in any kind of standardization route. We want to get everybody new chairs. Invite purchasing in, have them be a part of that conversation. You may pick a chair that purchasing can't get, and you've spent weeks, months maybe looking at trying to implement this standardized purchase program, and if you had purchasing at the table while you're discussing this, again, you may have got it done a lot quicker or had less roadblocks. That's expanding your committee. You then have the opposite. You then have maybe we need a narrower focus. So picking, 1, 2, maybe 3 people that are going to be a part of a small steering committee within the committee. So looking at specialty projects, maybe you want to do survey with your employees. You don't need the whole committee doing it, but have maybe 2 to 3 people initiating, gathering that data, and then they can report to the committee what the findings are. Trials, again, having a small group of people gathering data on trialing new products, new processes, that kind of thing. So try not to, whether it be your health and safety committee or your ergonomics committee, just having the same people all the time. Those people are going to be your key people, and they're definitely going to be people you're going to want to be trained and knowledgeable on. But be open to the idea of guests or breakout groups so that you're able to achieve a higher level of information and knowledge so that you're going to be able to make better choices along the road. So when it comes to assessments, this is probably the pitfall of most of the committees I've either had the opportunity to work with, sit on. A lot of the committees where I have ongoing relationships with my clients, I actually sit on those committees as a subject matter expert every meeting. And assessments is definitely one of those areas where we want to use assessment tools. We want to understand risk. But at the same time, we're not experts in this, and we get bogged down in just running numbers, and we never actually get to the point where we're making change. And we need to keep that in mind. The goal of having a committee isn't to sit around a table and talk about our ergonomic woes. That will happen. But at the end of the day, it's change that we're always trying to move forward, and it's positive change that we're trying to achieve. So although a certain amount of assessment is great, it brings a bit of standardization to your committee. It brings, everyone's on the same page. If we can all agree that, we've all checked this hazard identification checklist and we're all in agreement that this hazard is, an issue, then that's great. And when you're looking at your Occupational Health and Safety Act, we're told we need to identify hazards. So one of the tools I usually recommend my committees have is a really nice ergonomic checklist, whether it be for the office, whether it be for, job specific, or whether it be more industrial in nature. You can work with developing that, whether you used a standardized tool that's come from, let's say, the MSD Prevention Guideline Series or Ministry of Labor or another, company, or whether you've worked, let's say, with someone like us and we've customized something that's going to be specific to you and your work and your needs. But have a good identification tool checklist. That is something that is easy to train on. It gets everyone speaking the same language, and it is a requirement of your Occupational Health and Safety Act. So it offers multiple benefits. So once we have that identification process happening, half the battle is done. Whether we need to take it to the next step and how we do that risk assessment component, I usually like to bring my committees back to the MSD Prevention's guides, and they have a very interesting verbiage around the risk assessments. And you can see here, outlines two methods of risk assessments: a simple risk assessment and an in-depth risk assessment. So your in-depth risk assessment is a lot of what my committees try and take on. They want to use the same tools I do. They want to run NIOSH calculations. They want to use the Liberty Mutual tables. They want to use postural analysis. And that's great. However, I spent a lot of time in school learning how to do these and use these, and I use them every single day. So the amount of time it takes me to do an assessment and the amount of time it takes a committee to do an assessment is vastly different, and it's not necessary. If you have a hazard that's been presented to you, whether it be through an identification process or whether it be because you have an injury on that job or an employee's come forward with a complaint, if as a committee you can sit around that table and say, yes, this is a problem, and yes, this needs to be fixed, that is it. That is all you need to do as far as the committee goes. Find a way that you can document that, because that's, again, going to help with your due diligence. But don't get completely bogged down in the minutia of running an industry standard ergonomic assessment. Your simpler risk assessments will put you in a very good state, because it will move you then on to the next phase. And that's the phase you actually want to be in. You want to be in the control phase. You want to be thinking about how can we fix things. And then from there, the implementation phase of actually changing. So if you have a committee currently and you're finding that you're just not getting traction, you may find that if you really look at what your process is and what your program is expecting of you, if you're spending a lot of time at the risk assessment phase, again, it's just an area that I've seen not more than one of my clients kind of struggle with, and they want these hard numbers, maybe because management is asking for them, maybe because they're just number oriented, but they get lost in the numbers and they never move on to actually getting ideas about how to make it better. So really keep this in mind. A simple MSD risk assessment, being basically consensus within the group, is totally acceptable and is definitely a route that for a lot of your hazards, I would recommend that you try to implement. If you need an in-depth risk assessment, if you need to run every ergonomic risk tool out there, that is where I would usually recommend, it's been easy for a lot of my clients because I'm actually sitting in the committee, but bring a consultant in, get that one issue that's, kind of confounding everyone and has everyone scratching their head and they don't really know if it's high risk and they don't know what to do about it. That's the one that you farm out. Work on the majority of the issues and leave the specialty ones to the specialists, because again, it'll stop your momentum. And once you stop momentum in a committee, whether it be health and safety or ergonomics or anything, it is really, really challenging to get that back on and get back on track. So this diagram's right out of your MSD prevention resource guide. And as you can see, it says if everyone agrees on the MSD hazards and the root cause, it's not necessary to do an in-depth risk assessment and start choosing how to implement the controls. So it's not just me saying this, it's our prevention guide as well, which was put together by all of our right key people, WSIB, Ministry of Labor, safety associations. So keeping that in mind. The next one we're going to talk about is training. And this is not just good for, getting everybody on the same page, but good training can do a lot of wonderful things. First and foremost, it's going to unite your committee. It's going to unite them through knowledge. They're going to be able to speak to the things they liked about the training, the things that they didn't. They're going to be able to take the same examples away, and it becomes an opportunity for you guys to connect on a lot of different levels. And depending on the training you do, hopefully it has opportunity for you to work as a group and brainstorm as a group and kind of come up with some of your issues. Often when we do Ergonomics Committee training, we ask you to bring to the table, what are your top 3 issues you're dealing with right now? And those become our case studies. And you get the added benefit of working through your training with the problems you're dealing with while you have a professional certified ergonomist kind of at the forefront. So we're able to kind of help gear and strategize. So what better way to get not only kind of your mindset around ergonomics as a group, but also right from the get-go start tackling some of your hard-hitting issues while you have a certified professional right with you. So be picky with your training is essentially what I'm telling you. It's more than just gaining information. I mean, we could all go online and probably read, what's ergonomics and how to do this and how to do that, and you're gonna lose out on the opportunity that you have here because of the breadth that ergonomics can expand into. It really helps if your team works well together and that they learn those skills right from day one. It'll help them propel them onto a path that's just going to work really, really well. What we recommend you do is work with your trainer. Try and identify what are those assessment tools. So as I said earlier, we have some clients that say, I want to use all the same tools you use. And we will do that. We definitely have gone in and we've trained on the Liberty Mutual tables. We've trained on ANSI. We've trained on Rula. And I would say, and I think probably my business partners would agree with me in saying that at the end of the day, and it's 3 long days at a minimum, the word that comes to mind for everyone's look on their face is just overwhelmed. Some of them aren't even able to execute them well during the training, and it's really hard to expect them to all of a sudden be able to do it well once the training's ended and you don't have that person kind of holding their hand. So look at training on tools that you expect them to use. Put some critical thought into what those tools are going to be. So definitely your identification checklist. Spend some time developing or choosing a checklist that everyone likes, that speaks a language that everyone's going to kind of tune into and is going to be speaking to the industry that you're in. If you're in, warehousing, you should be able to either pull or create a hazard checklist that's going to really allow you to capture kind of the intricacies that your industry leads to. If you're in healthcare, same thing. And you can't expect a warehousing checklist and a healthcare checklist to look the same. You shouldn't anyways. And that's where sometimes when we just pull a checklist offline, we lose some of that customization. You're pulling the same thing that, a school or a college would pull, and then you're using it in the same place that maybe a mining or industry or foundry or something would work with. And it's going to be challenging just trying to get a really nice picture of what the hazards are and how they pertain to what you do. So spend some time develop or pull a checklist that's going to work for you. Then look at what are our expectations. We have our hazards. How are we going to move forward with them? If there's certain tools that you want them to know more about, then build them into your training program. But again, keeping in mind that simple risk assessment is really going to be a key component to moving you forward. If you feel that you need to run these in-depth risk assessments for every hazard that you have, it'll be challenging getting traction. So look at what's out there. If you're talking to a consultant, they can definitely help steer you into what they think would be applicable. If you're highly administrative, if you're from the college sector or government and you have a lot of offices, in that case, there stands some good reason and background that you may want to build in office assessments, which aren't a bad assessment to do. It's not that complex, and it's under the CSA guidelines. So they have got really nice, they've packaged it really nicely to be trained on. So spend some time on what you're going to expect out of your people and build that around your training agenda so that you're able to not just give people the knowledge and the tools to work with, but they're going to be able to take them a step further and start working as a committee right from that starting point. So hopefully what we're looking for effective ergonomic training will be definitely spending some time on understanding the hazards, understanding, the weight of them, what maybe will stress a person more or less. If we're looking at repetition as always being a huge hitter, shall I say, we may be focusing on the wrong thing. I know I've had one instance comes to mind when it came to repetition was an automotive factory that I was working in, and I had a lady seek me out while I was on the floor, and are you planning to come see me today? And I wasn't. So I kind of took a detour and went to see her, and on our way to her workstation, she goes, I'm not having any problems now, but I'm really concerned. They've just given me a new workstation, and it's just really, really repetitive. And I just know I'm going to get hurt, and, I want to make sure that that doesn't happen. And I showed up, and it was magic for me. It had just been engineered and designed so well. There was adjustability. Everything was in the right ranges. It was just ergonomically, it was a beautiful workstation. But this individual had got so focused that repetition was going to be the straw that broke the camel's back, that really what ended up being supposedly me doing kind of an assessment on her workstation ended up being a one-on-one job coaching moment where I kind of explained that, if everything else is in line, repetition is not a horrible thing for our body. So that's a key point. That's a good thing for our ergonomics committee there to be able to speak that language, not just for their own understanding, but they're also going to be our voice to the other workers in the company. And when questions or concerns come up, they're going to be the voice that kind of gives a bit of clarity there. An identification tool, as I said, and specifying and maybe streamlining what ergonomic assessment tools you choose to make. At the end of the day, the focus of any ergonomics training should be how are we going to evoke change? What process do we have for implementation? How are we going to move things forward? How are we going to get buy-in? That is a key point that often gets lost in a lot of training, and it's something that you want to really stress because that's what we're wanting our committee to do, is come up with ideas, come up with plans that we can then implement and hopefully roll out with a positive effect. So Pro is really committed to helping companies elevate their ergonomic success, and because of that, as a thank you for coming to this webinar, we have a very special gift that we're offering to 5 people today. We're hoping that we can offer a 1-hour lunch and learn for your ergonomics or health and safety training committee free of charge. So we'll be providing free training to your committee on how to elevate their ergonomic success and strategies and be able to provide more of a continuous improvement model within the committee structure. So I believe that this would be a great value to anyone that has an ergonomic or health and safety team that they're wanting to boost how they work with their ergonomic issues or concerns. And at the end of this webinar, we'll be sending out an email. So simply just reply to that email and the first 5 people we'll be in touch with so that they can take advantage of just a 1-hour free lunch and learn. So the other thing that you can, if you're going to customize your training, is if you have a process that you have to work with, it's important to let your committee understand that process. If, for instance, in order to get an office assessment completed, there are certain steps. Let's say my first step is I need to make my supervisor aware that I'm having concerns or issues. Maybe it's not your supervisor. Maybe the person I need to make aware is your health and safety or occupational health nurse. But make that clear, because again, that committee is the people that your employees are going to go to. So if they understand the process, if you have a policy or a program, that should also be part of your training. So having it clear what the process is so they can educate others on how to get certain things addressed and how it's going to be addressed. Because just because I put in a complaint or a concern does not mean I'm going to end up with a new workstation tomorrow. In fact, it may mean I don't end up with anything tomorrow, except, you know, maybe some adjustments being made or some job coaching or educationing happening. Okay, so again, another point that you can add in and customize your training to better not just help your committee, but your employees as a whole. So looking at what I think is kind of the primary focus for an ergonomic committee or a health and safety committee for that matter is, you know, looking at opportunities for implementing effective controls. Stressing the word effective, because you can, and that is where I find anyways that, and it's not just committees, it can be, you know, myself and my partners, we will often go back and forth because you can come up with 20 different controls. One may eliminate the rest of the 19 of them, but you may not be able to do that one. So you then have to pick and choose out of all the controls that you've laid out on the table, which ones are going to be the best fit, which ones are going to be the most feasible, what's going to get the most buy-in. And it becomes challenging to try and wade through what could be 10s upon 20 controls just for one hazard on its own. So what we're looking at is trying to make sure that we always stay focused, that we always kind of look at the end of the day, what impact are we making? Are we making an impact? Are we just meeting around a table and talking and nothing's really getting beyond that point? If that's the case, we need to take a step back. What are we doing that can push this forward? We need to make sure that we're implementing our controls. Are we implementing controls? And then if you're getting to the point where you are implementing controls, are you or can you conclusively say that they are effective? Or are they engineering controls? Are we constantly going for, you know, more administrative controls? Administrative controls are great, and they can be a little bit easier for our committees to wrap our heads around. Things like stretching programs, job rotations. We find that, you know, we're not talking about gears and sprockets and bushings when it comes to some of those controls, and we're able to just understand the concept and what's going to be involved and what's entailed when it comes to administrative controls. But research has proven that you can't make the kind of change we're hoping to make in our committee through administrative controls alone. And invariably what our model is usually a hybrid of both. We don't feel that you can necessarily just roll out engineering controls and ignore the administrative ones either. So this lady, this individual who'd come to me with these concerns about her very repetitive job, they'd rolled out a piece of machinery that was, from an ergonomic standpoint, just beautiful, but they'd missed out huge components on the administrative side. They missed out on an education opportunity. They definitely bypassed a buy-in opportunity. That, whether or not my one-on-one job coaching was successful, they may have an ongoing continuous problem with this individual and this new workstation because there wasn't an administrative opportunity to get her buy-in and make her understand why is this so much better than what she was working with before. So we really endorse kind of a hybrid. So for every engineering control we put in, how are we going to massage that on the administrative side to make sure that we're seeing the biggest success that we possibly can. And then looking at the tracking. The tracking is hard, and it can be a great kind of startup project for your ergonomic committee. I'm not sure if many of you received or even read it, but this month we always try to align our newsletters to kind of complement our webinars, and one of the components in this month's newsletter was about ergonomic committees, and one of the talking points was tracking. So looking at how we can use our committee to actually track data, because if that's the case, then we can actually show that we're being effective. And I can unfortunately say I've had committees that I've seen kind of dissolve or be disbanded because they have not been able to show that they've been effective or a positive impact to the company. And that's a shame, because the chances are they were. And one of the committees I was sitting on when this notion came or was mentioned that, well, we might not be doing the Ergonomics Committee anymore because we're just really not seeing, any traction here. We're not seeing any movement and any positive gains. We sat down as a committee and went through, and we found 251 changes that we'd made in a year and a half. The majority of which were to a positive and impact, if not neutral. The problem is, what had happened is, being the humble Ergo committee that we were, we would come up with our controls. We would then be required to hand that off to engineering, continuous improvement, maintenance, supervisors, and to actually implement and make sure that it happened. And what ended up happening is those 251 successes that we had were being absorbed by other departments. When we brought up the fact that, oh, well, we changed this and we implemented this and this height was lowered, they were like, oh, no, that was on, engineering's goals and successes. And I'm like, no, that was ours. We came up with that. They're just the ones that made it happen. So tracking becomes important to make sure that you're able to stay viable as a committee, and to also kind of boost your own morale, because I won't lie and say that, every control that you put out there is going to have a happy ending or is going to be received well. And it's always nice to be able to look back on your successes when those maybe not so successful ones come up. And then you can kind of reassure not just yourselves, but the committee, management, your employees that, we're a worthwhile committee to have around, and we're making an impact and we're causing change. So look at using that information, that tracking information, those assessment tools, and picking your battles. We'll often get two approaches. I will see committees go for the kind of low-hanging fruit, for lack of a better analogy, in that, oh, well, this person wants a piece of anti-fatigue matting, so that's really easy to do, let's do that. And they kind of work on this very surface level, trying to address their problems. And the problem is with that approach is you don't really get down into the root cause. Why does the person need anti-fatigue matting in the first place? Or braces is another one. Oh, I want a wrist brace or an elbow brace, and we're really quick to hand those out, but well, why are they needing them in the first place? So pick your battle as to what you want to spend your time on, whether it be that low-hanging fruit, whether it be, a massive kind of systemic problem that is in the hazard that you've identified that you really need to find a resolution for. But always remember that for some of these more in-depth problems, your time is probably better spent, knowing when to call in the pros. The diagram on this slide is just kind of an indication that was, I think, a part of a presentation in an article that actually Jen wrote. And it's basically showing kind of the indication of, if you have a claim. So if that concern or hazard that you've identified actually moves on to become an injury, what those costs are going to look like, what the time expenditure may be, as opposed to just bringing someone in and getting it dealt with quickly, efficiently, and with the reassurance that they're a certified professional and will guarantee their work. So picking your battles and knowing what to spend your time on. I've seen a lot of committees lose months, and I'm not kidding when I say months, on one project, and to the point where they lose so much steam, and the impression from management and the employees know that they've spent 4 to 6 months working on this, that the resistance that's met at the end of it isn't worth the 6 months of time and effort that you've put into it. So always keep that in your back of your mind. Try and keep, I don't know how you can embed that in as a process, but knowing when to put our time and energy into it, and when do we call a professional in. So as I said, I'm a big proponent of celebrating our successes. The one company that I sat on and that we had all of our successes being taken away by other departments, was a life-changing moment for me when I work with my committees, and it's to the point where it actually brings out a lot of the fun in what we do is when we celebrate our success. So, developing an ergonomics board, making it fun, having memos that go out, whether it be, stretching kind of jokes, that type of thing, trying to keep people engaged in ergonomics and safety and in general. But whenever we do something, it goes up on the board. Before and after shots are great. We had a lot of fun bringing the employees on the floor in, taking the before pictures, kind of highlighting and circling all the areas that the employees were finding concerning, that the Ergonomics Committee had identified as hazards, and then at the end showing how those circles weren't there anymore. That's a really great pictorial. It leaves a great impression, and you can really go home at the end of the day feeling good about those types of visuals. But definitely take credit for the things that you do and make sure that everyone is aware of those. Pat yourself on the back, be a little bit gratuitous in those efforts, because I have gone into some companies where, as an outside consultant, I'll go in, our primary thing that we do will be to talk to employees. And I've had people turn around going, oh, I really don't have time to talk to you. You're part of the Ergo guys. Yeah, they don't ever do anything right. So I'm just not going to waste my time. That's a horrible place to be. And I don't want any of our clients to be in that position, and definitely don't want anyone on this webinar anyways, to be in that position, because ergonomics is really for the benefit of your employees. It is only going to make things better for them. If it's done right, it's going to make things better for everyone. So don't let people have a bad impression about, safety and ergonomics. Take every opportunity you can to celebrate the successes and make sure people are aware of them and enjoy. So just to kind of go through some of the committees that I've sat on. One of the committees, we kind of named it the Ergo Return to Work Committee, and it was a bit different. It's definitely different from anything that I've discussed today. It wasn't set up like a joint health and safety committee is, where you have worker reps and management reps. It was a team of specialists. So they definitely had internal people. They had their health and safety, their HR manager, they had the union president. Often the plant manager would sit in on these, but they also had, for every internal person, there was an external. So I was the professional ergonomist at the time. They had a corporate doctor, a physiotherapist, and our goal every month was to sit down as a team. We would review any of the return to work first, because obviously that's retroactive. We want to make sure those people are getting to work quickly so that those costs aren't getting higher. So that was our first primary concern. And then we would look at being proactive and any ergonomic issues that were either being brought forward or that I'd identified. And as a team, we would go through with the employees individually and work with them on providing exercise programs for them, stretching programs for them, biomechanical job coaching, and then working with the engineers on how we can make their workstations the best we could. So it was a really interesting team to work on. We were very successful in what we did. And I would say in an industry that maybe had some, let's say, some preconceived beliefs on what we could do, we made very positive strides there. In fact, the HR manager provided this quote for us. So just kind of saying that we were a multidisciplinary group that was primarily focused on proactive intervention. And our successes were rooted in how not only the support we got from our management team, but the buy-in and the effects we had on the employees, because they would sit at this table, they would feel very engaged because they had all these people kind of addressing their issues kind of on a one-on-one basis. And it moved things forward very quickly. And it was really hard to discredit or say, no, that's not right when you had that kind of team at your disposal. We had great employee buy-in because of that. So interesting approach, really unique, made a lot of headway in a very short period of time. So one of the other ergonomics committees that we worked on, it really is a model that is basically what I've been discussing. We had the occupational health nurse was a key player in that. So bringing in that, again, that return to work, because we can't, although we want to work proactively, that's our ideal, we can't ignore the fact that retroactive things are going to have to be addressed and need to be a prominent concern. Continuous improvement lead was present. We didn't get a engineer, but we would have a rotation of engineers depending on the day. So, which was nice because they would end up going away and talking about things amongst themselves. And then the next engineer would come in, and although they weren't there, they were completely up to speed. The union president was a part of it. We had a worker and manager representative as well. I sat in on the committee as the expert, subject matter expert. But again, met monthly, worked on some really, really kind of groundbreaking initiatives during our tenure there. So it was an assembly kind of component. One of the projects they worked on, they were finding that based on the sequence that they were adding parts, that by the end, everything was so tight and so snug that you basically needed, a tool or, a mechanical device to kind of manipulate the assembly to get the last few parts in. And we worked on that to make sure that we actually re-sequenced how the parts went on, so that as the parts went on, it would automatically align the assembly so that the next part would fit in perfectly. And we showed 200% reduction in manual forces required. So really, really neat things. They did a trial with wood flooring versus matting, looking at, sat in on the design and review of a lifting device from an external provider, as well as just doing the day-to-day, getting their identifications done, job coaching to employees that needed it on how to work more biomechanically, and returning people to work just that much faster. So again, just a reminder to check your inbox and reply ASAP, as only the first 5 companies will be eligible for the 1-hour lunch and learn for your ergonomics or health and safety committee, and it will be free of charge. So expect to see that come through your inbox shortly, and we really look forward to hearing from you. If any of you have questions at this time, please put them through, and I can address them as they come in. I really appreciate your time, and I thank you for giving me this last hour, and I hope you have a great week. Okay, so Jen has a couple of questions that came through during the session. So how many people should be on a committee? That is usually going to be a reflection of the size of your organization. If you are a committee of a company of, let's say, 100 people, you're not going to have a ton of people. You may just have, 3 to 4 people maybe sitting on your committee. At the end of the day, even if you are this, multi-conglomerate of an organization or facility, you don't want to get overwhelmed. I think one of the pictures in the session showed just voice boxes over top of each other, and that can happen if you get too many people. So generally speaking, if you're able to pull the right people, so someone from an engineering or maintenance perspective, engineering or continuous improvement perspective would be one. A maintenance person would be great. A supervisor, because they're often the voice on the floor, is another key one. Your health and safety person, maybe someone, or again, that person from the Joint Health and Safety Committee. So kind of at a minimum, I would say between 5 and 8 people on a committee should be a really nice committee to work with. Then bringing on those guests or breaking out the steering committees as you see fit, depending on the projects you're working on. Don't be afraid to bring on guests. They won't have as strong a voice, potentially. So you can, it's a nice way of being able to expand the committee on projects that need maybe more involvement without changing your key players. And as long as your key players are strong and again have that really good training and foundation under them, I found that it works really well when just bringing people in as on a needed basis. Another question that we have is when would you recommend an Ergo committee does a complex assessment? That really depends on the resources and training they have. And the problem is with the complex assessments is the frequency in which they get to use them. As I said, you know, as certified professionals, these are tools we use every single day. So for the ability, our ability to pull off a complex ergonomic assessment, it's still time consuming for us because, you know, every hazard or new, you know, issue has its own concerns and issues to work around. But it definitely becomes a timely matter. The problem we have with committees, even when they are trained on some of these complex tools, is they're going to be trained in July. When is the next time they're going to use them? Chances are they're not going to use them for months. At the best case, usually when we do training with our committees, we'll say, okay, you know, we've done them for the day or the 3 days or the week that we've been there. We've been on the plant floor. We've kind of inundated them with experience what we have, and we usually give a follow-up call kind of the next day, next week, saying, okay, we're able to get your committee out and do them again on their own, because without that frequency, they're not going to be well versed in a complex assessment. So going back to the question, if you have people available that are familiar with those assessments, then it's going to be those ones that you just don't know what to do with. You can't get that consensus. If you're sitting there and you're having the fight between management and employees saying this is a hazard and management saying no it's not, or vice versa, it's sometimes a really nice way to let's not sit here arguing about this anymore. Let's do a risk assessment or a complex assessment because it's going to tell us exactly whether we're exceeding guidelines or whether we're within guidelines. So really, I only recommend doing a complex assessment when you can't get consensus. And then again, it's whether or not you choose to use your committee to do them or whether you say, okay, we'll just get this piece of the puzzle done by someone who can get us an answer quickly and confidently. So I hope that answers that question well. If not, by all means, if ever any of you have questions, you can always email us and we can address them or give you a call. Okay. All right. Well, I'll stay on for a couple more minutes, but that is the end of August's webinar. Again, please be on the lookout for your inbox if you're interested in the free Lunch and Learn. And we will see you next month. The next month's webinar is on cognitive demands. So we're finding now a lot of our physical demands are done, but our medical professionals are now wanting to know, well, what's the cognitive impact here of this job? So Jennifer will be speaking on cognitive demands assessments next month. We look forward to seeing you there.